answer is yes, the next most important question is, are you enjoying things that you usually enjoy? Because if you are not, that is 100% that you're depressed. And then other things like worthlessness. So are you convinced that you're a burden to your family? Do you see your life as meaningless? And the depression, as some of you unfortunately may know already, the depression becomes your worldview. I mean, you can't sort of step outside yourself anymore and see that your thinking has changed. It just becomes your thinking. So the worthlessness, there's guilt, thinking that your loved ones would be better off without you, thinking that the cancer is destroying their lives. Often financial concerns come into this. In addition, spiritual concerns come into this, because it's not uncommon to look at other people, friends, families, and see who do not have cancer and feel envious or angry at the things that they worry about as being sort of trivial. And I think that for a lot of people, that sort of adds to this whole experience that cancer brings of being not me. It's another thing that cancer takes from you. And so it can make people feel very guilt-ridden and very much not like themselves. And then what can happen too is suicidal thoughts and plans with depression. I'm going to mention this more because what happens is even in people who would never, ever, ever think of themselves as someone who would do something like that, if depression hits you, it often comes with suicidal thoughts, just all by itself. It's like a side effect. And most people are shocked and frightened by this if they haven't had those feelings before. And so if it should happen, even a passing thought, I would say let us know, because that is a good marker for depression. And so when, in the whole cancer treatment, does depression hit? It hits sometimes right at the beginning, but oddly, often not there. That's sort of a less frequent time. But when treatment is completed and you move to surveillance, that's when it hits. A lot of people feel like what happens is they kind of put off all the emotional stuff, and then once they're through all the treatment and everything, that's when it's time to deal with the emotional stuff. If your disease progresses, if your cancer is advanced at diagnosis, you're more likely to be depressed, and if your treatments fail. So anxiety. So anxiety disorders are different from the kind of anxiety we'll talk about. Some people come into cancer with full-on anxiety disorders like obsessive compulsive disorder. This is the one that's on the program monk, where you're checking, thinking about the same things, worried. It can take people 2 hours to get out of their house in the morning because of all the things that need to be checked before you leave. A very treatable disorder, relatively common. Panic disorder, in which you become overwhelmed suddenly by feelings of dread. It has a lot of physical symptoms such as palpitation, shortness of breath, nausea, sometimes diarrhea, lightheadedness, and it's episodic and it feels horrible when it happens. Sometimes people with panic disorder become suicidal because of the helplessness of being able to control when it comes. Post-traumatic stress disorder, there's more research now in people who have been treated for cancer about post-traumatic stress disorder. This is a disorder where when you've been through something that really is physically and emotionally very trying, think IL-2, people have nightmares about parts of the experience, that things remind them of it during the day, maybe even a smell or a sound, and they sort of have a vivid memory, almost a flashback. Things that remind them of these episodes will also trigger terrible anxiety and fear, and they have an increased startle response. And so that's PTSD, again, very treatable. It's been in the papers a lot because of people returning from the war. And then generalized anxiety disorder, which is just this high level of anxiety that has peaks. It's with you kind of all the time. Okay, so there are 7 sort of general questions that we use that indicate a generalized anxiety disorder, and this kind of anxiety disorder will come on during cancer treatment. So it's in the past week, did you feel nervous, anxious, or on edge most of the time? And that's about sort of irritability as well. Is it impossible to stop worrying? Do you feel so restless that you can't sit still? Do you have shorter fuse than usual? Are you constantly worried about what else might happen? You worry relentlessly about what the future can hold, and do your worries run around the same track over and over again? So that's for GAD. Now I'm going to move into treatment a little bit. So I'd like to really emphasize the non-pharmacologic treatments for depression and anxiety, because these are effective. There have been some pretty good studies on these. So cognitive behavioral therapy, which some of you may have heard of, it's a very structured therapy in which you work with a therapist or a workbook to identify the thoughts that are causing you pain and to sort of recast them and find other ways of dealing with it. It sounds kind of odd because it sounds so simplistic, so how could it possibly work for emotions that are so difficult to tolerate? But it actually does work, and it can happen, as I said, with a therapist, in a group, or with a workbook that you can get in the self-help section of almost any store. Group therapies and support groups are very effective as well. And couples therapies or individual therapies with somebody like myself and Catherine. Lifestyle changes, I think, are pretty important. Cancer, as you all know, really does throw a wrench in the works. So one of the things is to resume sexual intimacy, because often cancer is so isolating, and in couples, people are trying to protect each other and can have some distance. And of course, chemotherapy and some of the side effects and some of our medications for treatments of side effects interfere with sexual activity as well as the surgeries and things. But it's important, I think, to try and get back to sexual intimacy if it's been an important part of your relationship. And we'll talk about that a little more if you want to. Also, exercise. And of course, with both sexual activity and with exercise, it's important to adjust the intensity and frequency to what your physical condition is at the time. You can talk with your team about it, with oncologists about it, and nurse practitioners. Yoga has been shown to be very helpful in both anxiety and mild depressions, as well as the adjustment reactions. And it would be best to stop using alcohol. The rate of addiction to alcohol goes up astronomically with the diagnosis of cancer. And alcohol is a depressant. In the short run, of course, it makes you feel sort of less anxious, less worried, and feels like a kind of relief. But even the next day, and certainly in a chronic way, it tends to drive you down. And so if you have a kind of, adjustment reaction with depression, alcohol can make the difference between something that's manageable and something that becomes a major depression. And then good sleep habits, which are tough. Usually we need medications to help with that. And think about decreasing caffeine and allergy medications that are stimulating. And then we talked a little bit before about dietary supplements. I say beware of them. I mean, a lot of them do say that they will be helpful for mood, anxiety, and those kinds of things. If a substance, whether it's an herb or a supplement, is active, it will have side effects. That's sort of the rule of the game. If it is active, it needs to be metabolized, and we don't know what effects that might have with chemotherapeutic agents, and we worry about that with antidepressants as well, so something like Sandy or St. John's wort can fall into that same category. Most of them are uncontrolled, so we don't know how much active substance is inside them. And if you saw the recent Frontline report, we don't even know if what they say they are is actually in them. And so I think in this context, it might be best to just stay away. And I know I sound like, some kind of a scientific whatever, but, I'm not averse to them outside the cancer context. But I think in this mix, no. So medication treatment for us, it's still trial and error. We can sort of make an informed choice, though, by looking at previous history of antidepressant use and how it affected you and if it worked, and looking at a history of your family members. So if anybody in your family took a particular medication that worked, it's likely to work for you. Preferred side effects. So in cancer treatment, we don't like to add any medication that doesn't do more than one thing. And so some of the antidepressants can help sort of with concentration and attention. So if there's a fogginess involved in some of the treatments or the medications for side effects, we choose those. Some of them are really good for sleep and for appetite. Some of them are good for nausea. And so we always try to choose one that we would like the side effects as well. We also choose based on the interactions with other medications and with chemotherapeutic agents. And we look at your clinical trials to make sure that we choose one that isn't excluded. So it's more art than science, and my little thing didn't come up, I'm so bummed. So anyway, this was like this yellow and orange and green and pink thing that looked like one of the diagrams that Tony just showed you, except it has no labels on it, and you don't know anything. So these are the medications, though, that you may need along the way. I don't expect you to memorize these. The point of this slide is that a lot of medicines here, like the anti-seizure meds and the psychostimulants like Ritalin and the atypical antipsychotics like Seroquel, we use to boost antidepressants, to boost narcotics for pain control, and to help with sleep and anxiety. And so although these are generally